Hello, everyone. My name is Kayla Streepy, and welcome back to another Faculty Profile podcast. This week, I'm here with Liz Clayton, Assistant Professor of Undergraduate Nursing at Henderson State, and she is also a registered nurse.
Yes, thank you for having me today.
Thank you for coming. Is there currently a high demand for nurses throughout the healthcare profession?
Oh, absolutely. Probably one of the highest demand jobs that is there. I read a statistic that we need something like, it's over 200,000 new nurses every year to meet the demand of patients between now and like 2031. So we need over 200 new nurses every year. So we are constantly looking for ways to make the profession enticing and draw people to it and bring people into that inner fold and, in hopes to find that happy balance of meeting the needs of the people all across the United States, really all over the world.
Why is nursing such a good career to pursue?
I think nursing has opened up more doors in my life personally, and I have seen it really do amazing things for a lot of people just in the experiences and the contacts that you make. But it is one of those arenas that, like I said, you can be that source of comfort.
Would you say that's kind of what it takes to be a good nurse?
That's a good part of it. I think, we have some very blanket qualities that are important, being able to multitask, having patience, being able to commit to being a lifelong learner. The body and the science, it changes all the time. We certainly want people that are honest and are going to be accountable for their actions and what they do. But there are just hundreds and hundreds of ways to be a nurse, and really we can find a nursing position that suits the needs of anybody, and however you want to be a nurse, we probably have a position that would fulfill that for you. If you're interested in the technology, we have informatics. If you want to do education, clearly you can come and teach. But not even just in the academic setting. We have patient educators that's all they do day in and day out is educate patients about their diseases. So there's just a gajillion different ways to.
What would you say makes Henderson State's nursing program such a good choice for aspiring nurses?
So I think that our nursing program really embodies the motto that we have here at Henderson, in that we are the school with the heart, and that principle of caring and showing up and showing out and banding together and kind of rallying for that common cause. I think the nursing department, being that it's such a small department, we do that day in and day out with all of our students at varying levels and degrees. And I just think it's a really special place. We have pretty small classes in the undergraduate program, usually around 30 or so, which compared to some other large universities, you're looking at 100, 150, 200 students in your class. So a very individualized program.
What kind of degree programs does Henderson offer?
So we have a few. We have our traditional undergraduate Bachelor's of Science in Nursing. That's where I teach, and it is 2 years of an undergraduate program where you are pretty much every class is going to be over in the nursing building. We spend time doing lecture. We have a simulation lab. We go to clinical, where you actually get to practice in the role as a student nurse, practicing the skills, practicing documentation, talking with actual patients, seeing actual things that can go wrong with the human body. Very hands-on training.
Could you tell us a little bit about the high-tech mannequins?
Sure can. So, in our simulation lab, we have four, we call them high fidelity simulation mannequins. And so, what that basically means, it's a $10 word for it, is a mannequin that can be programmed to do pretty much anything the human body can. So, we have heartbeats, we have bowel sounds, you can feel pulses, their eyes blink, we can talk through a microphone, and as the student is interacting with the mannequin, we as the instructor can talk through the mannequin to give them like true at the moment responses based on whatever they're giving us. We can give that kind of immediate feedback. We have a sim mom that can labor and give birth to a baby. We have babies, we have children, and then we have just a regular adult that is like not pregnant. And they can all do all kinds of things. They have bodily fluids that we insert into them, so as they're learning things about drains or IVs or the bladder, all these things, we can have actual, it's not actual, it looks like bodily fluids. So they're really practicing true to life skills. It's very cool. We also have four other, they're kind of low fidelity, so they look very realistic and they're great for practicing. Our entire simulation lab looks like what you would walk into to find a hospital with different bays, or we have clinic rooms that are set up for like what it would look like when you go to your regular doctor. We have a room that's set up like an ICU room, so you have a window where you're able to see your patient and interact with your patient, and they give vital signs like your blood pressure, and they breathe, and very cool technology. We're hoping to continue to add to that. We're applying for grants, so hopefully we should be seeing some more money being injected into that, and it should only get better.
It sounds like you're setting your students up for success with such realistic models. And
yeah, so I mean, when you're in the hospital, you don't always get to experience every situation. Even if it is a common situation, you don't always there at the right time to see it, so we can actually manipulate that in our sim lab to give those students those experiences.
Very cool. Are there any specific requirements for prospective nursing students to apply for admission at Henderson?
There are. So for the undergraduate program, there are some core classes that need to be, it's general education classes that have to be done and completed before you would enter into the nursing program. You can certainly apply earlier. Maybe you still have some summer courses to take. Go ahead and apply in the spring. As long as you finish and the grades are good, that would not prevent you from being accepted and entering into the nursing program. You do have to have a 2.7 GPA, a letter that kind of discusses your strengths, your interests, volunteerism, or any other kind of extracurriculars. And then we have a RN to BSN program, which is completely online. So this is for nurses that are already graduated and are looking to continue on their education. It's totally online. They do have to have a license as a registered nurse with either the Arkansas State Board or it needs to be like a multi-state license, so they're able to practice in different states. They have to have a 2.0 GPA, and then there's a few other little small criteria that they would have to do. We have a couple of different master's level tracks. We have one in executive leadership, and this is really good for those that are looking to go into those leadership positions, or maybe that are already working in leadership positions with their bachelor's degree and are wanting to learn more about all the ins and outs of how to manage resources or quality improvement, things like that. And then we have our master's or MSN track for family nurse practitioners. So these are nurses that act as a primary care provider, and you would see them either in an urgent care clinic, or you might see them at a family practice clinic, or maybe even in a pediatric or a geriatric type clinic, something like that. So all across the lifespan, they are able to take care of, and they manage chronic illnesses, diseases. They're able to prescribe medications, and so that's a whole track in and of itself. And we have a certificate in nursing education, and then if you're completely undecided but you have a bachelor's and you don't know what you want to do, we have a badge where you can take 2 graduate level courses and kind of dip your toe into any of those and figure that out.
How do students apply to these programs?
So all of our applications are available online through the HSU Nursing Department website. When you go there, it's actually pretty well laid out. We have our undergraduate, our RN to BSN, and then graduate programs. You just click there and kind of follow through the processes. We accept applications in the spring for the upcoming fall semester. The RN to BSN program, they have a fall and a spring start date. So apply at any time with those. But yeah, it just takes getting your little application packet with most of the things that we've already talked about.
Is it possible for students to arrange a tour for the nursing facility?
They absolutely can. We love it. We actually love giving tours, and we kind of like showing off our simulation lab. You can either schedule that with Christopher Gardner through admissions, or you can schedule it by calling our building directly and scheduling it with Miss Manning.
Could you tell us a little bit about yourself and kind of walk us through your history and experience with nursing?
So I became a nurse when I was 21 years old, which is pretty young. I think most people are a little bit older. A lot of people come into nursing as a second career, and we're open to all that. We like people to come to nursing. So I joined the Army when I was 18 years old with a designated job of becoming a licensed practical nurse, and that's where I started. After I got out of the Army, I went back to school, became an RN, and from there went on and got my master's, and have worked in all kinds of different environments. I've done inpatient, like med-surg type, your regular hospital unit, so to speak. I've worked in ambulatory care or surgery centers. I've worked in clinics. I've worked in care coordination, trying to help manage people with a lot of different diseases and helping them to kind of understand how to be the healthiest versions of themselves while living with chronic diseases. And I have been a nurse now for, gee golly, 16 years. Started teaching like right about two and a half years ago, and I've loved it. It has been a very different way to use my nursing skills, but it's been a very enjoyable, just very different, but very cool. I like it.
What would you say motivated you to pursue a career in nursing?
So when I was a kid, I had a childhood illness, and when I first went to the hospital, I had a doctor that said, "What do you want to be when you grow up?" And I was like, "I want to be a doctor." And I just knew I was going to be a doctor. And after spending a good amount of time in the hospital, I realized it's not the doctors that are making me feel better, making me feel cared for, that are giving me the attention. It was the nurses. And I base a lot of how I am as a nurse on how those nurses made me feel. So it was a very eye-opening experience for me, and I just knew from a very young age that's what I was going to do.
What would you say about this profession you find the most fulfilling?
So there are times where you kind of get to be that steady rock for a person when they are either at their worst or going through a terrible experience or really unfamiliar with the experiences that they're going through. And there's a lot of anxiety and fear, and sometimes out of that you kind of get people that display that in an angry way. And being just kind of that rock and educating them through and showing them the grace and the understanding of it's okay to feel not good. But this is what we're going to do. We're going to take care of you, and you kind of just see that calmness kind of come over their face. And it's those very human connections that are just incredibly fulfilling and really are the goal in my nursing practice.
How does teaching nursing compare to practicing it as a nurse, like in a hospital?
So they're both they're both very demanding type of jobs. But I will say, like, in the hospital, at the bedside, it's more of a physically demanding. It's making sure that, all these tasks are completed. It can be very task-oriented. Whereas now I'm on this education side, and yes, there are certainly tasks to do, and there are certainly milestones and benchmarks and things to be mindful of. But I think the biggest thing is that now I no longer feel like, well, I have to do this to make sure that this person gets better. It's now I have to make sure that all my students know this thing so that they can make people feel better or improve their health or whatever the case may be. It's kind of almost more like feeling like a worried parent or like a mother hen kind of. I don't know. I just want to make sure all my little ducklings are kind of under my wing and are getting what they need to know so that they have the tools to carry on and take care of people.
So how do you handle stress and maintain your composure during high-pressure situations?
So nurses tend to do a lot of practicing, a lot of repeated drills, a lot of continuing education, so that they're able to really react in those situations without stopping and thinking about it. And so it's more you just kind of go into that mode of I have to do A, B, C, D. We really rely heavily on debriefing scenarios to kind of process what we went through, how we felt about it, what can we do to be better, and use it as a sort of reflection to improve our practice as we go. I personally, a lot of deep breaths and really loud music. That's how I decompress. It's usually after the fact. In the moment, it's just time to perform.
Well, thank you so much for talking with me today.
Absolutely. Thank you for having me.
This has been Kayla Streepy and Liz Clayton with your Henderson State Faculty Profile Podcast.